sir. Assalamu alaikum. And what's your name, sir?
Hesham Al Hemeiri. I'm the Deputy Director of IT Department in the Ministry of Health.
My name is Mubarika Ibrahim. I'm the Health Information System Director at the Ministry of Health.
So, how has healthcare been turning smart now?
Well, it's a broad, it's a broad question. Right now, it's easier to focus on the number of services that we have, and then we'll talk about how those services have moved towards being smart. Right now, in the Ministry of Health, we have roughly 600 services, in which 400 services are considered administrative services, and 200 of them are considered as health or medical related services. In terms of administrative services, we have roughly automated about 350, 340 services, which are now accessible online. Such services include licensing for medical establishments or pharmacies, licensing for doctors, pharmacists, or medical technicians, even treatment abroad, or things like having a certificate for what's it called? What's that? I forgot. It just doesn't come to mind. But these services all together, they consolidate roughly in something in the range of 350, and they have been active throughout 2000, from mid 2014 until this day.
And what are the various services you are offering in terms of smart healthcare?
Well, in terms of smart healthcare, the focus for us today at the Ministry of Health stand is around the patient portal. We are the first in the Middle East who have done a full integrated patient portal with the back end as one system. Because now we're running Wareed, which is our system, which is Cerner Millennium, and the patient portal is one integrated. So in the patient portal, we're actually empowering our citizens to be able to know about their medical record, which is now currently that the patient can come and he can register at any facility. Then they were going to be sending for him a username and a password, and then he can actually access the patient portal on his website. And then from there he can view his appointments, he can see his vaccinations, he can see his medication profile. So all the information that actually is being kept at the patient record at the level of the facility is being actually opened to the patient themselves. So we're actually with this, we're empowering our patient to be more knowledgeable about what is there for them. And the second phase actually, we're going to be actually opening more of visits, e-visits, where the patient can go online and book for his appointment. So from the premises of his home, he can have the service given to him by a doctor who can actually cater for all the issues that he have and diagnose it remotely, and then prescribe for him the right medication. With this, we're actually going to be getting the customer for MOH, knowing more about their health, getting more in control about what they should do, and actually also we're actually shortening the time for them to be around the facilities. They can get the service within their comfort of their houses.
One thing that's noteworthy is that we are now trying to always achieve, we've always tried to achieve higher levels or higher flights, right? So at the moment, we began by having these services accessible through the website, but now they're accessible through the mobile device, which basically gets to the point of reaching the smart government initiative. For example, if someone now would like to, issue a good standing, the good standing certificate, they can either do it through the website online or their mobile device or smart device.
These services actually that has been provisioned by the MOH is more around how, and as per the direction of His Highness Sheikh Mohammed bin Rashid, is that we need to reach the people at their premises, at their houses. We don't have to don't have to come to us. So our all services, when we have actually developed it, we made it online, interactive, smart, easy to use, just for the consumer or the customer to be able to cater for that service within his own comfort zone.
Thank you.